Would you like free audiobooks? Click the link in the description. Question 1. A patient with breast cancer is scheduled to undergo a mastectomy. Which of the following interventions should the nurse prioritize in the preoperative education of this patient? A. Teaching about postoperative drainage care. B. Discussing future breast reconstruction options. C. Educating on the importance of arm exercises post-surgery. D. Explaining the process of chemotherapy. Correct answer. C. Educating on the importance of arm exercises post-surgery. Rationale: arm exercises post-mastectomy are crucial for preventing lymphedema and ensuring the patient maintains a range of motion. This intervention helps minimize postoperative complications and promotes quicker recovery, making it a priority in preoperative education. Question 2. A nurse is caring for a patient who has just been diagnosed with lung cancer. Which of the following statements by the patient indicates a need for further teaching? A. I should consider getting a second opinion. B. I will need to quit smoking immediately. C. Chemotherapy will cure my cancer. D. I should discuss treatment options with my family. Correct answer. C. Chemotherapy will cure my cancer. Rationale: this statement indicates a misunderstanding. While chemotherapy can be effective in treating cancer, it is not always curative, especially depending on the stage and type of lung cancer. Further education is needed to set realistic expectations and prepare the patient for treatment. Question 3. Which of the following is the most appropriate nursing action when administering vesicant chemotherapy to a patient? A. Use a large bore needle for administration. B. Apply a warm compress to the site before infusion. C. Ensure the intravenous site is flushing well before administration. D. Administer the medication as quickly as possible. Correct answer. C. Ensure the intravenous site is flushing well before administration. Rationale: ensuring the intravenous site is flushing well before administration of vesicant chemotherapy is critical to prevent extravasation, which can cause severe tissue damage. This step is crucial for patient safety during vesicant chemotherapy administration. Question 4. A nurse is preparing to administer filgrastim to a patient with neutropenia secondary to chemotherapy. Which of the following outcomes should the nurse anticipate? A. Decrease in white blood cell (WBC) count. B. Increase in red blood cell (RBC) count. C. Increase in platelet count. D. Increase in neutrophil count. Correct answer. D. Increase in neutrophil count. Rationale: filgrastim is a granulocyte colony stimulating factor that stimulates the production of neutrophils, thereby increasing neutrophil count and reducing the risk of infection in patients with neutropenia secondary to chemotherapy. Question 5. A patient receiving radiation therapy for head and neck cancer reports difficulty swallowing. Which of the following nursing interventions is most appropriate? A. Encourage intake of dry, solid foods. B. Suggest eating large, less frequent meals. C. Recommend nutritional supplements in liquid form. D. Advise to avoid fluids during meals. Correct answer. C. Recommend nutritional supplements in liquid form. Rationale: patients undergoing radiation therapy for head and neck cancer often experience mucositis, leading to difficulty swallowing. Recommending nutritional supplements in liquid form can help ensure they maintain their nutritional intake while minimizing discomfort. Question 6. The nurse is assessing a patient with melanoma. Which of the following findings would be most concerning? A. A mole with uniform coloring. B. A lesion with smooth, well-defined borders. C. A mole that has changed in size, shape, or color. D. A lesion that is less than 6 mm in diameter. Correct answer. C. A mole that has changed in size, shape, or color. Rationale: changes in the size, shape, or color of a mole are concerning signs that may indicate melanoma. The ABCDE rule, asymmetry, border, color, diameter, evolving, is a guide to the usual signs of melanoma, making option C the most concerning finding. Question 7. A patient with colorectal cancer is experiencing severe pain. Which of the following nursing interventions is most appropriate for managing this patient's pain? A. Administer prescribed analgesics on a fixed schedule. B. Wait for the patient to request pain medication. C. Use non-pharmacological methods exclusively. D. Limit opioid use to avoid addiction. Correct answer. A. Administer prescribed analgesics on a fixed schedule. Rationale: for severe cancer pain, administering prescribed analgesics on a fixed schedule rather than on an as-needed basis is more effective in managing pain and preventing pain escalation. Question 8. A nurse is teaching a patient about self-care after receiving brachytherapy for cervical cancer. Which of the following instructions is most important? A. Avoid using tampons for at least 6 weeks. B. Limit physical activity for the next 2 weeks. C. Drink at least 2 to 3 liters of water daily. D. Maintain a distance of at least 6 feet from others for a specified period. Correct answer. D. Maintain a distance of at least 6 feet from others for a specified period. Rationale: after receiving brachytherapy, patients may emit low levels of radiation for a temporary period. Maintaining a safe distance from others, especially vulnerable populations, is crucial to reduce their exposure to radiation. Question 9. A nurse is caring for a patient undergoing chemotherapy who develops thrombocytopenia. Which of the following interventions is most appropriate? A. Encourage participation in contact sports. B. Apply manual pressure to injection sites for at least 10 minutes. C. Administer aspirin for pain relief. D. Increase the intake of green leafy vegetables. Correct answer. B. Apply manual pressure to injection sites for at least 10 minutes. Rationale: patients with thrombocytopenia are at increased risk for bleeding. Applying manual pressure to injection sites for an extended period helps prevent bleeding. Aspirin should be avoided due to its antiplatelet effects, and contact sports increase the risk of injury and bleeding. Question 10. Which of the following symptoms should the nurse instruct a patient receiving immunotherapy to report immediately? A. Fatigue. B. Diarrhea. C. Hair loss. D. Nausea. Correct answer. B. Diarrhea. Rationale: diarrhea can be a symptom of immune-mediated colitis, a potential side effect of immunotherapy that requires prompt management to prevent severe complications. While fatigue, hair loss, and nausea can be associated with cancer treatments, diarrhea in the context of immunotherapy is more concerning and warrants immediate attention. Question 11. A patient with prostate cancer is being treated with hormone therapy. The therapy includes a gonadotropin-releasing hormone agonist. Which of the following side effects should the nurse educate the patient about as a common consequence of this therapy? A. Increased libido. B. Hot flashes. C. Weight loss. D. Hyperglycemia. Correct answer. B. Hot flashes. Rationale: gonadotropin-releasing hormone agonists can lead to a decrease in testosterone levels, which may result in side effects similar to those experienced during menopause in women, such as hot flashes. It's important for patients to be aware of this potential side effect to manage their expectations and seek appropriate interventions. Question 12. A patient undergoing chemotherapy for ovarian cancer develops neutropenic fever. Which of the following actions by the nurse is most appropriate? A. Prescribe antibiotics. B. Initiate cooling measures. C. Isolate the patient. D. Increase fluid intake. Correct answer, C. Isolate the patient. Rationale: patients with neutropenic fever are at a high risk for infections due to their compromised immune system. Isolating the patient helps protect them from potential pathogens. While antibiotic therapy is crucial, it is prescribed by a physician, not a nurse. Cooling measures and increased fluid intake may be supportive but do not address the primary concern of preventing infection. Question 13. When caring for a patient with metastatic bone cancer, which of the following assessments should the nurse prioritize to monitor for potential spinal cord compression? A. Periodic limb movements. B. Sudden onset of back pain. C. Changes in bowel or bladder function. D. All of the above. Correct answer. D. All of the above. Rationale: spinal cord compression is a serious complication of metastatic bone cancer. Symptoms can include sudden onset of back pain, changes in bowel or bladder function, and weakness or numbness in the limbs. Prompt identification of these symptoms can lead to timely intervention and prevent permanent damage. Question 14. A nurse is providing education to a patient with lung cancer who is scheduled to start targeted therapy. Which of the following statements by the nurse is most appropriate? A. Targeted therapy is less effective than traditional chemotherapy. B. You should not experience any side effects with targeted therapy. C. Targeted therapy focuses on specific genes or proteins to stop cancer growth. D. You will be cured after completing targeted therapy. Correct answer. C. Targeted therapy focuses on specific genes or proteins to stop cancer growth. Rationale: targeted therapy works by focusing on specific molecular targets associated with cancer, such as genes or proteins, to block the growth and spread of cancer cells while minimizing damage to normal cells. It's important for patients to understand that while targeted therapy can be more precise, it may still have side effects and is not necessarily curative. Question 15. A nurse is assessing a patient who has been receiving radiation therapy for bladder cancer. The patient reports severe fatigue. Which of the following interventions should the nurse recommend? A. Complete bed rest until the fatigue improves. B. Strenuous exercise to increase energy levels. C. Planning activities to allow for regular rest periods. D. Increasing caffeine intake to combat fatigue. Correct answer. C. Planning activities to allow for regular rest periods. Rationale: fatigue is a common side effect of radiation therapy. Recommending that the patient plan their activities with regular rest periods can help manage fatigue without leading to the complications associated with prolonged bed rest or the temporary solutions provided by caffeine. Question 16. A nurse is caring for a patient who is experiencing mucositis as a result of chemotherapy. Which of the following dietary recommendations is most appropriate? A. Consume spicy foods to stimulate saliva production. B. Eat dry, coarse foods to promote mucosal healing. C. Include soft, bland foods in the diet. D. Increase intake of acidic fruit juices. Correct answer. C. Include soft, bland foods in the diet. Rationale: mucositis can make the oral mucosa very sensitive. Soft, bland foods are less likely to irritate the mucosa and can be easier for the patient to consume, promoting nutritional intake without exacerbating the condition. Question 17. Which of the following symptoms in a patient receiving immunotherapy should prompt immediate referral to a healthcare provider? A. Persistent cough. B. Mild fatigue. C. Occasional nausea. D. Intermittent headache. Correct answer. A. Persistent cough. Rationale. While mild fatigue, occasional nausea, and intermittent headache can be common side effects of immunotherapy, a persistent cough may indicate a more serious complication such as pneumonitis. Immediate evaluation is necessary to manage potential lung inflammation. Question 18. A nurse is educating a patient with leukemia about infection prevention. Which of the following pieces of advice is most crucial? A. Wash your hands frequently. B. Avoid crowded places. C. Take antibiotics as a preventive measure. D. Wear a mask at all times. Correct answer. A. Wash your hands frequently. Rationale. Hand hygiene is the most effective measure to prevent infections, particularly for patients with leukemia who are at increased risk due to compromised immune systems. While avoiding crowded places and wearing a mask can also help, frequent hand washing is fundamental. Question 19. A patient with Hodgkin's lymphoma reports pruritus. Which of the following nursing interventions is most appropriate? A. Advise the patient to take hot showers. B. Recommend the use of fragrance-free moisturizers. C. Suggest the application of topical steroids without a prescription. D. Encourage scratching for relief. Correct answer. B. Recommend the use of fragrance-free moisturizers. Rationale. Pruritus, itching, can be a symptom of Hodgkin's lymphoma. Fragrance-free moisturizers can help soothe the skin without causing further irritation. Hot showers and scratching can exacerbate the condition, and topical steroids should only be used under medical supervision. Question 20. For a patient undergoing chemotherapy who has developed chemotherapy-induced peripheral neuropathy, which of the following safety measures should the nurse emphasize? A. Walking barefoot to improve foot sensitivity. B. Using ice packs on extremities to reduce pain. C. Installing grab bars in the bathroom. D. Engaging in high-impact exercises. Correct answer. C. Installing grab bars in the bathroom. Rationale. Chemotherapy-induced peripheral neuropathy can affect balance and sensation, increasing the risk of falls. Installing grab bars in the bathroom is a preventive measure to enhance safety and reduce the risk of injury. Question 21. A patient with pancreatic cancer reports severe abdominal pain. Which of the following pain management strategies should the nurse prioritize? A. Administering prescribed opioid analgesics. B. Encouraging deep breathing exercises. C. Applying a cold compress to the abdomen. D. Promoting dietary changes. Correct answer. A. Administering prescribed opioid analgesics. Rationale. Severe abdominal pain in pancreatic cancer can be intense and requires effective pain management, often with opioid analgesics. While non-pharmacological strategies can be supportive, they are not sufficient for managing severe pain. Question 22. During a follow-up visit, a patient who underwent treatment for colorectal cancer reports new, unexplained weight loss. Which of the following actions should the nurse take first? A. Advise the patient to eat high-calorie foods. B. Schedule the patient for immediate imaging studies. C. Document the weight loss and report it to the oncologist. D. Suggest joining a weight management program. Correct answer. C. Document the weight loss and report it to the oncologist. Rationale. Unexplained weight loss after cancer treatment can be a sign of recurrence. The nurse's first action should be to document and report this significant finding to the oncologist for further evaluation. Question 23. A nurse is providing education to a patient scheduled to begin radiotherapy for prostate cancer. Which of the following potential side effects should the nurse include? A. Hair loss. B. Urinary incontinence. C. Increased appetite. D. Peripheral neuropathy. Correct answer. B. Urinary incontinence. Rationale: radiotherapy for prostate cancer can affect the bladder and urethra, leading to urinary incontinence as a potential side effect. Educating the patient on this possibility allows for better preparation and management. Question 24. A patient with breast cancer expresses concern about the toxicity of chemotherapy. Which of the following responses by the nurse is most appropriate? A. Chemotherapy is completely safe with no side effects. B. Side effects are a small price to pay for curing your cancer. C. We will monitor you closely and manage any side effects that occur. D. You can refuse treatment if you are worried about side effects. Correct answer. C. We will monitor you closely and manage any side effects that occur. Rationale: this response acknowledges the patient's concerns while providing reassurance that side effects can be managed effectively with close monitoring and appropriate interventions. It supports patient education and involvement in care decisions. Question 25. When providing palliative care to a patient with terminal lung cancer, which of the following nursing interventions is most important? A. Discussing advance directives. B. Ensuring adequate pain management. C. Planning postmortem arrangements. D. Encouraging discussion about the afterlife. Correct answer. B. Ensuring adequate pain management. Rationale: while all these aspects may be important in palliative care, ensuring adequate pain management is a priority to improve the quality of life for patients with terminal illness. Effective pain control allows for more meaningful interactions and comfort during the patient's remaining time. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.